Man who is already past 60. This is for you. If you still have respect for your own body and want to remain strong in your intimate life, then you need to listen carefully to what I am about to say. Many men ignore this subject out of shame or because they believe this is nonsense, but later they end up paying with pain, frustration, and regret. What I am going to reveal here is not curiosity, it is a serious warning. It is your dignity at stake. Taking care of the penis has nothing to do with vanity. It has to do with health, autonomy, and longevity. Those who neglect this part of the body risk facing problems that could have been avoided with simple actions. But when they realize it, they are already dealing with constant inflammation, loss of sensitivity, or erection failures that never return. I am Dr. Breno Clark, urologist for more than 1 decade, and I have seen men cry in my office after realizing they ignored important signs for far too long. Most of them had no idea how seemingly harmless attitudes were slowly destroying their intimate health. That is why today I am going to expose directly the 10 most dangerous behaviors that a mature man should never practice with his own penis. Maybe you will recognize some. Maybe you even do one of them thinking, there is no problem. But I guarantee these mistakes add up over the years and turn sexual life into constant suffering. And pay attention, the last item on the list is the most serious. Precisely because almost no one realizes they are making it. If you truly care about your virility, stay with me until the end. Let us begin. Error number 1. Ignoring strange signs on the penis. Many men notice some change as burning, peeling, different smell, spots, or small wounds, and prefer to pretend they did not see it. They think it was from friction, that it will get better on its own, or that it is not a reason to go to the doctor. That is exactly what happened with Mr. Ernesto, 76 years old. He noticed a thin reddish line on the side of the penis, but thought it was just dry skin. He applied ointment on his own and let it go. 2 months later, the region was more sensitive. Discharge was coming out, and even putting it inside his pants hurt. When he finally sought help, there was already advanced inflammation that required prolonged treatment, something that would have been easily resolved if he had taken care of it in the beginning. A man who values himself does not wait for the problem to explode before acting. Persistent burning, change in smell, cracks, change in skin color, constant itching or bleeding. None of this is normal. The sooner the problem is faced, the faster it is resolved. The penis also gives warnings. You decide whether to listen or ignore them. Error number 2, resorting to homemade remedies and miracle devices. When discomfort appears, many men rush to the easiest solution, and also the most dangerous one. They apply ointments they found in a drawer, use alcohol, vinegar, or oil on their own, follow recipes from the internet, and in other cases, try improvised devices or aggressive stretching techniques. These practices, besides being ineffective most of the time, often cause burns, microtraumas, infections, and even circulation blockage. That is what happened with Mr. Alvaro, 73 years old. After noticing slight difficulty in maintaining an erection, he preferred not to seek a doctor and started using an improvised ring made with an elastic band to hold the rigidity. The elastic got stuck and compromised local circulation. Besides panic and pain, emergency care was necessary to remove the object and a prolonged treatment until full recovery. If he had sought medical guidance from the beginning, he would have avoided all that suffering. The penis is not an experimentation field. Homemade products, inappropriate substances, and improvised devices may seem like quick solutions, but they often turn a simple problem into a serious situation. Treatments only with professional guidance, appropriate products, and proven techniques. Never use something on the intimate organ that you would not apply to a sensitive wound on the face or eye. If the intention is to improve sexual function or solve discomfort, seek a specialist. There are safe and modern treatments. Improvisation is not one of them. Error number 3, neglecting penis hygiene. This mistake may seem obvious, but it is precisely the most underestimated, and one of the ones that most increases the risk of serious problems over time. Many men think that washing over it is enough, that shower water solves everything or that avoiding touching the area is a sign of care. In practice, light and continuous neglect creates a perfect environment for irritation, fungi, bacteria, and chronic inflammation. Uncircumcised men need extra attention. The foreskin must be gently retracted during the bath to properly clean the glands. When this does not happen, secretion residue, smegma, accumulates and fuels repeated infections. On the other hand, excess is also harmful. Harsh soaps, scented products, and strong scrubbing irritate the penis's sensitive skin, causing micro-lesions that become entry points for infections. I will give an example. Mr. Manuel, 66 years old. He thought a quick shower was enough and never retracted the skin to clean. Over time, a persistent odor appeared and a whitish layer under the foreskin. He ignored it until the discomfort turned into pain. When he sought help, he already had chronic balanitis and needed prolonged treatment, antibiotic therapy, and guidance for daily hygiene, something that would have been avoided with simple care from the beginning. Pay attention to the signs that precede the problem: constant itching, whitish layer, redness that keeps coming back, strong odor, burning when urinating. None of this is normal or inevitable with age. These are cries for help from the body. How to prevent: practical and direct rules. Gently retract the foreskin during the bath, if present, and wash the glands with warm water. Use neutral, unscented soap and apply gently. No scrubbing until redness. Rinse very well and dry carefully before getting dressed. Moisture facilitates fungi. Avoid intimate douches, scented powders, and products not indicated for mucosa. If you notice discharge, pain, bleeding, or persistent odor, see a doctor immediately. Do not wait for it to go away. Proper hygiene is not fussiness, it is prevention. 1 minute a day of simple care prevents weeks of suffering, appointments, treatments, and, in rare cases, more serious complications. Those who respect themselves take care every day. Error number 4. Ignoring pain, wounds, or any sign of blood. Many men feel burning when urinating, notice a small crack in the skin, or see a drop of blood on the paper, and pretend they did not see it. They believe it was chafing, heat, or a thing of age. But pain and bleeding are never normal, and ignoring these signs turns something treatable into something dangerous.
I have already followed the case of Mr. Armindo, 74 years old. He noticed a small wound at the base of the penis after intercourse. Since it did not hurt much, he applied regular ointment and continued his routine. Days later, the wound began to burn and bleed slightly. Even so, he insisted on waiting. When he finally sought help, there was already an infection installed, requiring antibiotics and daily dressings. Wounds, cracks, burning, or blood should never be ignored. They are clear signals that the body is asking for attention. It may be just mild irritation or the beginning of something more serious. Only a professional can determine. A man who respects himself does not get used to pain. He investigates and solves it before it gets worse. Error number 5. Trusting too much in "it will go away on its own." Many men feel discomfort when urinating, experience burning during intercourse, or notice that the stream is weaker, and believe it is just fatigue, dehydration, or a thing of age. Instead of investigating, they prefer to wait, but repeated symptoms never appear for no reason. When the body sends a warning and the man ignores it, the problem evolves silently until it becomes much more difficult to treat. That is what happened with Mr. Jordan, 77 years old. He started to feel mild burning after urinating. Since the discomfort came and went, he thought it was just temporary irritation. Over time, he started getting up more often at night to go to the bathroom, but even so, he preferred not to mention it to anyone. When he finally agreed to seek help, the diagnosis was already advanced prostatic hyperplasia with the beginning of a urinary infection. If he had treated it at the first sign, it would have been resolved with a simple medicine. But because he waited too long, he needed prolonged treatment and changes in routine. A symptom that repeats is not a coincidence. It is a call for attention. Burning, weak stream, pressure when urinating, discomfort after intercourse, urge to urinate all the time. None of these signs should be ignored. A man who takes care of himself solves it early and suffers less later. Error number 6, staying seated for hours without moving the area. Many men spend most of the day sitting, watching television, driving, playing cards, or simply resting in the same position. The problem is that staying for long periods without moving the pelvis reduces blood circulation to the penis and the organs of the intimate area, favoring swelling, numbness, varicose veins, and erection difficulty over time. That is what happened with Mr. Augusto, 79 years old. Retired, he spent entire afternoons seated in the same chair. Over time, he began to feel tingling at the base of the penis and a feeling of heaviness in the testicles. He thought it was just fatigue, but the discomfort only increased. When he sought guidance, he discovered that the prolonged position was compressing the vessels responsible for local circulation. It was enough to include small movement breaks throughout the day for the problem to disappear. A healthy penis also depends on circulation. Staying seated straight for hours blocks blood flow in the intimate area, and poor circulation means reduced sensitivity and weaker erections. Standing up every 1 or 2 hours, walking for a few minutes, or simply moving the pelvis is enough to keep the body working well. Those who take care of posture also protect their virility. Error number 7, abusing alcoholic beverages and cigarettes, thinking that it does not matter anymore. Many men over 60 believe that since they have already lived long enough, they no longer need to worry about the effects of alcohol or cigarettes. Some say phrases like, now it makes no difference, or, at my age, this is not going to kill me anymore. But the body does not work like that. Even in moderate doses, alcohol and tobacco directly compromise the blood vessels, including those that carry blood to the penis. That was the case of Mr. Vicente, 80 years old. He smoked only 1 cigarette after lunch and drank a shot to relax at night. He thought it was too little to cause a problem. Over time, he noticed that the erection no longer came with the same firmness and took longer to be maintained. After exams, he discovered that circulation was impaired by the combination of nicotine and alcohol. He drastically reduced both habits and, in a few weeks, noticed a clear improvement in performance. What you put into the body gives back. Excessive alcohol lowers testosterone levels and harms sensitivity. Cigarettes narrow the vessels and make it difficult for the blood flow that sustains the erection. It is not necessary to stop completely, but reducing is an act of intelligence and self-preservation. Those who control what they consume preserve for longer what they wish to keep. Error number 8, wearing tight and suffocating clothes all day long. Many men, out of habit or vanity, wear tight underwear, very tight pants, or pieces made of synthetic fabric that do not allow the intimate area to breathe. The problem is that excessive heat and constant moisture favor irritation, fungi, itching, and even a drop in hormone production since the testicles work better at a lower temperature. That is what happened with Mr. Renato, 73 years old. He liked to wear tight underwear to feel more firm, but over time he began to feel burning and excessive sweating in the groin. He thought it was an allergy to the laundry soap, but in fact it was because of the synthetic fabric and lack of ventilation. It was enough to switch to looser cotton clothes for the discomfort to disappear completely. Penis and testicles need ventilation, not suffocation. Very tight clothes harm circulation, increase local temperature, and create a perfect environment for inflammation.
Wearing light, loose, and breathable pieces, especially to sleep, is a simple attitude that prevents several silent problems. Comfort is not luxury, it is prevention. Error number 9, completely ignoring routine exams. Many men avoid going to the doctor out of fear, shame, or simple stubbornness. They prefer not to know rather than face the possibility of a diagnosis. The problem is that diseases such as prostate inflammation, Silent infections or even early cancers only show clear signs when they are already advanced, and then treatment becomes more difficult.
That is what happened with Mr. Lorindo, 78 years old. He had never had a prostate exam and always said that, as long as it does not hurt, everything is fine. One day, he started to have difficulty urinating and noticed blood mixed in the urine. When he sought help, exams showed that he had an advanced inflammation that could have been easily treated if it had been discovered earlier. The doctor was clear: if he had had annual checkups, he would not have gone through the scare. Those who avoid the exam are not protecting themselves. They are putting themselves at risk. Simple tests such as PSA, ultrasound, or urological evaluation can detect problems early when they are still easy to resolve. An intelligent man does not wait for pain to get his attention. He prevents it before it arrives. Taking care early is always lighter than treating late. Error number 10, completely abandoning intimate life thinking that the age for it has passed. Many men, after a certain age, stop touching themselves, seeking pleasure, or having physical contact with their own body and with their partner. Some believe that it is no longer necessary. Others stop out of fear of failing. The problem is that the penis, just like any other part of the body, loses function when it is no longer used. That is what happened with Mr. Orlando, 81 years old. After becoming a widower, he spent years without any sexual activity, not even spontaneous erections. Over time, he noticed that the penis no longer responded as before, even when he felt aroused. When he sought help, he heard something simple: the body adapts to use. If you stop stimulating it, it understands that it no longer needs to function. With guidance and gradual resumption of intimate activity, he was able to partially recover the response, but he said it would have been much easier if he had not stopped completely. Sexual life has no expiration date, but it can atrophy from disuse. Maintaining some level of stimulation, whether through touch, affection, or intercourse, helps preserve circulation, sensitivity, and even the hormones responsible for well-being. The penis, just like a muscle, needs to be activated to keep functioning. Those who abandon pleasure before the time surrender their own vitality without a fight. Conclusion, and one last important message. If you have made it this far, it is because you truly care about your own health, and that already puts you ahead of most. Taking care of the penis is not vanity, it is not exaggeration, and much less fussiness. It is self-respect. It is ensuring autonomy, pleasure, and dignity for the next years of your life. Now I ask you one thing. Do not keep this information only for yourself.
Maybe you have a friend, brother, or colleague who is making one of these mistakes without realizing it. A simple share can prevent suffering for someone you care about. Send this content to a group of friends. Tag someone who needs to hear this. And if you want more guidance like this, follow and stay tuned for the next warnings I will publish. Intimate health is not a taboo. It is a responsibility. And the time to take care of it is now, not after the pain arrives.